Thank you very much for that opening comment, which I think sets the scene for what we're going to discuss in the next couple of days. Our second speaker is Jerry Heindel, who worked in the area of reproductive biology and toxicology while at the University of Texas Medical School in Houston and at the University of Mississippi before he came to the National Institute here to head the Reproductive and Developmental Toxicology Group. He's currently the Health Science Administrator of the Population Health Branch of NIEHS here in North Carolina. So, Jerry, do you want to, from where do you want to do this? Do you want to do this from up there or wherever is most convenient to you? Thank you for being here, Jerry Heindel. Okay, I'm going to get out of your way here.
Well, good morning. I'm really pleased to have the opportunity to talk to you today about where we are in the state of the science of the role of obesity and environmental chemicals. So my goal today is to provide a general overview of the field. So I'm going to give some history, some very general background to help set the stage, and then a few examples of where we are in the literature, understanding the role of environmental chemicals in obesity, and end with some data gaps and needs. So I think the field really started in 2002 with this review article by Paula Bailey Hamilton, Chemical Toxins, a Hypothesis to Explain the Global Obesity Epidemic. And in that article, she put together a couple of nice charts, and this one shows the increase in chemical production over time and how after a lag period of a generation or so, that correlated with the increase in obesity. So of course, it's just a correlation, but it pulled together a lot of data and got people thinking. But I think the most exciting thing she did was really do a complete literature search and look at the kinds of chemicals that you see here, because you're going to see all these chemicals again later. And she showed that way back in the early 70s and 80s, there were data indicating that these chemicals in toxicology studies actually did increase weight gain. But at that time, nobody was paying any attention to that because the focus was really on looking at decreased weight at the high doses and general toxicity. So then over the next few years, there were commentaries written, an initiative to develop the fetal basis of disease, which was in a general initiative, but certainly covered the area of obesity. And we held the very first symposium on fetal origins and environmental influences on obesity. And then the biggest change occurred in 2006 when Bruce Blumberg wrote a review article and coined the term obesogen. And I think that really stimulated the field because it caught on in the press. Then just in the last few years, the NIEHS has again put out an initiative to stimulate the field, and I'm going to talk to you a little later to show what we've actually done in this area. So what causes obesity? Obviously, it's multifactorial. It's genetics, and then all of this is environmental. And you're going to hear throughout the day, today and tomorrow, about viruses and antibiotics and nutrition, sugars and fats and additives and colorants. But I'm going to focus here now just on environmental chemical part of the environment. So I'm going to start at the very beginning. I think this is critical to set the stage because weight control is an endocrine issue. This is a complex, interrelated, highly orchestrated endocrine system with hormones like leptin and insulin and ghrelin and adiponectin constantly going back and forth and controlling appetite and satiety and controlling the reward or food cravings. So the importance of that is if weight gain is controlled by the endocrine system, that sets the stage and then provides a plausibility for endocrine disrupting chemicals to affect that system. So an endocrine disruptor is defined as an exogenous chemical or mixture of chemicals that interferes with any aspect of hormone action. And we can now make a list of over 800 chemicals that have some endocrine disrupting activity, and they fall into all of these different classes I've shown here. The point being, these were chemicals designed for a specific purpose, but also had a side effect that they can interfere with some aspect of the endocrine system. And they include pesticides and flame retardants and plastics and cosmetics, personal care products, sunscreens, a wide variety of chemicals. So the next question we have to ask then, is there really exposure? Is there enough exposure that we could have effects from these chemicals? So this is some data from the CDC indicating that they can measure close to 300 chemicals in cord blood of women, from the babies. And in a small study of 50 pregnant women, 47 chemicals were found in every one. And indeed, there are some chemicals here that are found in every one of thousands of people that were tested by the CDC. So certainly, there's a significant exposure to these endocrine disrupting chemicals. Now, of course, the presence of these chemicals in the womb doesn't mean they're causing any harm. But at the same time, it does mean we've accepted a strategy whereby every pregnant woman is contaminated with a variety of chemicals without her knowledge, with the potential for harm to either her or the baby. Okay, so that's sort of the background. Now let's talk about obesity. And we have to start back at this paradigm called the developmental origins of disease, because it's clear from the data in the last 10 or 12 years that developmental exposures to environmental chemicals can lead to a variety of diseases and dysfunctions later in life. That this developmental period, in utero or neonatal period or early childhood in humans, is the most sensitive period for environmental chemicals to cause disease and dysfunctions. And then these diseases and dysfunctions show up later in life, long after the chemical is gone. So while there are a variety of diseases that fit this, it turns out that obesity certainly is one. So that the sensitivity to develop obesity also has its origins during development. In addition, you can find some chemicals which will cause increased weight gain in adults, but we believe that the developmental time point is the most sensitive, and the entire field really has been focusing on this paradigm, developmental exposure to environmental chemicals, linking them to increased weight gain later in life. So here's the obesogen hypothesis, that obesity epidemic is due in part to environmental exposures during development. So the hypothesis is then that there is a subset of endocrine disrupting chemicals, which are called obesogens, that then act during development and disrupt adipose tissue development, so they alter the number of fat cells. And they also can alter food intake and metabolism by having effects on the pancreas, adipose tissue, liver, GI tract, brain, muscle, all these components of this integrated, coordinated endocrine system. And the result then is they alter the programming of the set point or sensitivity to develop obesity later in life. And this is what Dr. Dietz also mentioned. They aren't really causing it per se all by themselves, but increasing the sensitivity. So this is a very important point. It's very important that you all realize that we who are working in this field understand that food intake and exercise are very important, and they're certainly key to the obesity epidemic. But we believe that environmental chemicals are altering the set point or sensitivity for gaining weight. So that is, how much food does it take to put on weight? And how much exercise does it take to reduce weight? And those effects are occurring via alterations in this developmental programming of this endocrine system that controls weight gain. So this is the real proof of principle: maternal smoking during pregnancy on childhood weight at school entry, where there are over 20 separate epi studies that are all positive, showing increased overweight or obesity depending upon the cigarette smoking during pregnancy. And this shows up then at the time when they go into school. I think there's another proof of principle, and that is the developmental exposure to DES. So DES is diethylstilbestrol. It's a chemical, a drug that was given to millions of women to prevent miscarriage. It didn't actually do that, but in the offspring resulted in many different diseases and dysfunctions, including some very rare cancers. So this is an animal model, a mouse model, where DES is given just for 5 days from day 1 to 5 at birth. Then the exposure is completely gone, and you just follow the animals for the rest of their life. And initially, nothing happens, but once they go through puberty, and ones that were exposed to DES have increased weight gain. Now, I know some of you are looking at that and say, okay, well, that's a small increase in weight gain, but that's not the obesity epidemic that we're really seeing in humans. Well, maybe we just have to let these animals age a little. So if you let them go to about 9 months of age, this looks like a really morbidly obese animal, similar to what we see in the human population these days. So here's an example of the kind of research that's going on. This is looking at BPA. I think everyone's familiar with BPA, found in polycarbonate plastic and receipts. Developmental exposure. And here, not looking at weight gain, because weight gain of the animal is not a very sensitive endpoint, but indeed looking at percentage fat. So developmental exposure compared to the control, you can see there's increased fat and decreased lean. So if you measured the weight of the animals, you wouldn't see anything. But with this more sensitive measure, you can see that BPA is causing an increased fat. We're also starting to see some more mechanistic focused studies, and this is some unpublished data from Ross and Desai that I think is very exciting. They use the same kind of paradigm, developmental exposure to BPA, and this is a different model. And in this model system, they see weight gain, but they also see increased food intake. So when they went and looked in the brains, they could see increased appetite neurons and a decreased number of the satiety neurons, giving you some idea of the site and possible mechanism whereby BPA could lead to increased food intake and therefore weight gain. Here's another typical kind of study. Developmental exposure to a phthalate ester increases visceral fat tissue and adipocyte number. So DEHP is a plasticizer found in plastics and plastic toys. And again, if you look at the body weight at 12 weeks after this developmental exposure to the pregnant mother, you can see a little bit of increased body weight in both males and females. But what if you look at the actual fat in the tissue? Here's the control, and look at the huge amount of fat that's everywhere filling up the abdomen here. And that occurs at this lowest dose tested, 0.05. And then at 5 you see something, but look at here. At 500 milligram per kilogram, the usual dose that toxicologists are using to look for effects of phthalates on different systems, you don't see this increase in fat. There's a little bit of increase here, but if you are measuring the animal's weight, it won't show up. So this is another very important point. We have to use dose response curves going to very low levels because a lot of times the dose response curves are not linear. So how about human studies? There are now about 33 human epidemiology studies linking developmental exposure to an environmental chemical to increase weight gain in the children later in life. And I highlighted here that toxicants, they're usually PCBs or persistent pollutants or DDT, except for a couple of BPA studies that are now starting to come out. But the interesting thing is, here's intrauterine exposure to a chemical and body mass increase at 3 years of age. Here's one now looking at 6 years of age. These are different chemicals, but following at different ages to 9 years, and now all the way up to 20 years with this fluorochemical. So we're starting to get nice data from the epi studies matching some of the animal data. And here's the typical kind of result you get looking at PAH, which is air pollution exposure. The pregnant mom is exposed to the air pollution, and then at age 5 you can see as increased pollution exposure to the mother, increase in weight of the children, and it also shows up at age 7. And most recently, the most exciting but the most troubling data indicates that you can get transgenerational inheritance of obesity. So what everybody is studying and what I showed you is you give the environmental chemical to the pregnant dam, and then you examine the offspring, males and females. But if you take those males and you mate them with naive females, and you continue on and get the second generation and then third and the fourth generation, what people are finding is that the obesity that shows up in this first generation is also showing up in the third and fourth generation. And those animals have never seen the chemical at all. So this is transgenerational inheritance. And the data out there now with tributyl-tin, DDT, a hydrocarbon mixture of jet fuel, and a mixture of BPA and 2 phthalates. So this is very troubling because it says if a pregnant mother is exposed to a chemical, that can affect not only her children, but her grandchildren and her great-grandchildren. So here's where we are. This is the list of chemicals that has some data in either human or animals. And we believe this is just the tip of the iceberg, because it appears every month or two a new chemical is being added to the list. So we have the BPA and the nicotine and DES and tributyl-tin, and Bruce Blumberg is going to give you the tributyl-tin story, which is probably our the best story that we have going today. And then phthalates, there's even some lead data, air pollution, PCBs, and fructose, artificial sweeteners, a long list of chemicals that come from a variety of different places. So I mentioned that NIEHS has been funding grants in the obesity and diabetes area. We're now funding 57 grants. And if you look at them, 32 are human cohorts. So we have 20 studies ongoing with birth cohorts, developmental exposure to these kind of chemicals, and then following the children later in life, looking at increase in weight gain. So you can see over the next 4 or 5 years, there's going to be a huge increase in the amount of data that's put out, both from these 25 animal studies that we're funding and the 32 human cohorts, in addition, of course, to what's being funded around the globe. So this field, as I've tried to show you, really is only about 10 years old. So certainly there's a lot of data gaps and needs. And I put down a list of some of them here. I'm not going to go through that list because we're going to be discussing this list, and later on at the end of the meeting have a big discussion about it. But I just want to say one thing, and that is when a field is new, it really gives you the opportunity to help direct the research a little bit. And meetings like the one we're at here today, and holding grantee meetings where you bring all the grantees together, talk about who's doing what endpoints, what tissues can be shared, how the animal and human researchers can talk to each other. That can have a huge impact to help us to lower the number of data gaps and improve the impact on the field. Hopefully then the result will be that sooner rather than later, we'll have a much better idea how important environmental chemicals are to this current obesity epidemic. So thank you very much.